exactly why the insurance companies will not be able to survive, because they cannot continue with government.
Why?
And that is what people are going to have to do, and insurance companies will not be able to survive. And you say, well, they can keep their insurance. Yeah. Well, it's going to be cheaper than government.
Why, you know what, the myth here is, you're assuming. Well, okay. The assumption here is that these insurance companies, first of all, aren't going to go into the exchange. The assumption is that they're going to be asked to do what they're supposed to do to begin with. I mean, look, I would like to feel sorry for them, but I honestly can't, given, look, they're the only industry that's not covered under federal antitrust regulations.
Now, Republicans, not that I claim Republicans altogether, but Republicans have been pushing reform in our health care. They've been pushing things like tax credits and health savings accounts and tort reform and insurance companies competing nationwide rather than statewide. But Democrats have fought this tooth and nail because it does not give them power. They want power. They want to make my health and care decisions, but I want to make my own. And I'm not here because someone told me to come. I'm here because I care about this, and I do not want anybody else making my health care decisions. And you can look at other countries who have had government involvement in health care, and you cannot find one country or one state who had success without eventual rationing, or their people trying to come to America for health care.
Is the implication that I don't love the country? Or? Look, let me suggest this to you. I believe that with healthy competition and an exchange that insurance companies are going to go into, first of all, the basic 85% of Americans currently have private health care coverage.
And they'll lose it.
Well, look, if it isn't troubling, okay, if it isn't, okay, but if I can just complete the thought. If it isn't troubling to the people in this auditorium that they approve a claim and drop you, if you have diabetes or anybody in your family, these beloved insurance companies that we're so worried about aren't going to get it. Does it bother anybody in this auditorium that the CEO of Aetna pulls $200,000 a day? Does it bother anyone? Well, listen.
What about the millions of dollars that attorneys get?
All right, look, you can. Okay, look. I would just respectfully disagree with you in this respect. I don't believe that having insurance companies go into an exchange, they can go nationwide. It's not statewide under this bill. It's nationwide. They can compete nationwide. I put an amendment in this bill that I think will help keep insurance companies, private insurance companies in, and it's called a co-op. What the amendment was, and I failed to mention it, I wish I had it to begin with. If there's any farmers here, or real estate agents, or independent contractors here, Wisconsin, some farmers from Wisconsin came before our committee and testified and said, look, I'll be with you in 1 second. We have to negotiate with the insurance company on our own. Farmers usually do. But we decided we'd try something different. Just a group of farmers from Wisconsin, 60 of them, got together and formed a co-op, similar to a telephone co-op, dairy co-op, whatever. They negotiated as a group, 60 farmers, and they were able to get a 30% reduction in their monthly premiums because they went in as a group. And I said, well, here's an idea that ought to go nationwide. So if this bill, if the amendment stays in the bill, and I hope it does, it will allow independent folks, realtors, farmers, whoever, to go into co-ops to negotiate lower prices with the insurance companies. And I think that helps consumers out. It allows you to pick the plan, and then you don't have to, again, going back to the amendment, it doesn't force you to take the plan that the co-op comes back with, or the several plans that they may come back with. So the point that I want to say is, I don't want to run anybody out of business, and if I thought this was going to do it, I'd have severe reservations about it. But I have to tell you, I agree with you. You mentioned two things. You mentioned, I heard tort reform, and we're going to have a bill coming up probably before the end of the year on that. But we're also going to have an insurance reform bill that we're going to be looking at. My doctor, who's been in practice for 24 years, has never had a medical malpractice suit filed against him, and his rates have quintupled. He asked me a question I couldn't answer. He said, gee, Phil, you would think after 24 years I'd at least get a safe driver discount like they do with automobiles. The fact of the matter is, his rates have gone up 5 times, and he's never had a claim. I had another physician that said she had one lawsuit that was going to be filed against her that was totally baseless. And I said, well, what did you do? She said, well, I called my insurance company. And what did they do? They told me, just plead out, take too much time. I said, well, doctor, why in heaven's name would you do that when it's not, you didn't do anything wrong? That'd be like the equivalent of going in and getting arrested for something that you didn't do. Why would you do that? And besides, your reputation's at stake here. And she said, they told me it would take too much time and they'd take care of it and settle it out of court. Yeah, they did. And the following year, they tripled her medical malpractice insurance because of one claim. So what I'm saying to you here is there are people on both sides of this issue, and I understand that. People are getting, ordinary people are getting taken advantage of. Our doctors are. Look, we can cut healthcare costs. And in this bill, one of the things, all of us, I bring up, make you all happy, bring up the Internal Revenue Service. But we all have forms. They're all standardized. We fill them out differently based upon our information, but they're different. We could save 30 to 34% of medical costs alone if we did that. We tried doing that 10 years ago, and there was a huge pushback. Look, doctors need to spend more time with their patients, and so do nurses, than sitting there filling out claim forms all the time. And my doctor told me he spent 16 hours a week himself filling out claims. And we have stupid regulations out there at the Moline Hospital, for example, that need to be changed. If you're on the 5th floor and you need dialysis, they take you in the elevator down, they wheel you into the dialysis wing of the hospital, and you get the dialysis. If you're on the 4th floor, they take you downstairs, they load you into an ambulance, they take you to a dialysis center, they bring you back, and they charge you $500 for doing it. Now that's wrong. It's also wrong that we have states that take our healthcare providers and pay a year late. Doctors, hospitals, nurses.
That's the government, though.
Well, that's the government.
That's, well, look. Well,
Yes, that's why everybody's afraid of government taking over.
It's because you have...
I really feel bad for him. But it was the government that screwed you how many times? The government wants her to sign over her house. It's these government regulations. If you go to this single-pay government option...
It's not a single pay.
Eventually, that's what will happen. Is the government going to turn a profit? No. They're going to say, we're going to charge you 5% regardless. Well, the taxpayers will pay for it. How can a company keep up with that? And you want to put all these reforms in. This bill is 1,000 and some pages, yet not once do they address attorneys. And yet the medical malpractice and everything else drives these costs up. The other thing is that Medicare is going to save money because they're going to say, well, we're only going to pay this much for this procedure. So they're cutting the insurance companies back and the doctors. I don't have anything to do with the doctors and the insurance companies. But nobody has ever gone after the attorneys. You look at the TV, every day you turn on an ad, soap love and this one, that. Did you take this medicine? Did you take that one? But the thing is that you sign on for this and you get a few piddly dollars, and the attorneys get millions. Millions.
How much money do you take from the attorney? How much money
do you take from the insurance company, or from the insurance companies and from the lawyers, trial lawyers?
And then trial lawyers get 33% profit. 33% on any claim.
I'll answer the question. Hold on. In the back, there was one.